The alarming surge in adverse events linked to unauthorized versions of the popular weight loss and diabetes medication semaglutide has raised widespread concern among public health officials, regulatory authorities, and healthcare providers. Reports reveal that at least 10 fatalities and over 100 hospitalizations have been attributed to compounded versions of this medication, which is typically used to manage blood sugar in diabetes patients and aid weight loss. The crisis is compelling an urgent reassessment of the regulation of compounded medications, the safety of online marketplaces, and the responsibility of healthcare providers in guiding patients. The growing threat of unauthorized compounds. A recent investigative report by CNN brought the issue to national attention, featuring Novo Nordisk's president and CEO, Lars Fruergaard Jørgensen, who voiced serious concerns over the rising use of unauthorized semaglutide compounds across the United States. In his statement, Jørgensen emphasized that these products, although marketed as semaglutide, are not produced by Novo Nordisk, the sole authorized manufacturer of the drug. According to Jørgensen, patients who believe they're getting access to a safe product, and they believe they're getting semaglutide. I know for a fact that they are not getting semaglutide. The investigation highlights an unsettling reality. The fatalities and hospitalizations are likely only a fraction of the true toll, as many cases go unreported. Current federal laws mandate that only state-licensed pharmacies functioning as outsourcing facilities report adverse events to the FDA. This loophole suggests that the actual number of affected patients may be significantly higher than the 346 adverse events officially logged as of August 2024. The role of compounded pharmacies play a unique and important role within the healthcare system, providing customized formulations for patients with specific needs and filling gaps during drug shortages. However, the situation with semaglutide underscores how these facilities, when not properly regulated, can pose serious health risks. The demand for compounded semaglutide increased due to a shortage of the FDA-approved version. In October 2024, the FDA confirmed the shortage, which led many patients to seek alternatives. As demand surged, certain providers stepped in to supply unauthorized compounds, but not all of them adhered to the rigorous safety and quality standards mandated for FDA-approved drugs. This has given rise to a shadow market where various providers, some of whom lack the necessary experience or oversight, attempt to replicate the effects of semaglutide without ensuring its safety or efficacy. Regulatory challenges and FDA's response. The FDA has responded to the unfolding crisis by issuing clear warnings about the risks of unauthorized GLP-1 receptor agonists, the drug class to which semaglutide belongs. The agency statements make an important distinction. Compounded medications might be acceptable under certain conditions, but they do not go through the same stringent FDA approval process. This lack of oversight means that compounded drugs may not meet federal safety, effectiveness, and quality standards. Compounding these concerns, numerous reports detail a range of dosing errors in compounded versions of injectable semaglutide. These errors stem from various factors, including patients' inability to measure doses accurately, healthcare professionals misjudging the proper dosage, and some compounds containing concentrations significantly higher than what is authorized for medical use. Such discrepancies raise the risk of dangerous overdoses and unforeseen side effects, especially when patients administer these drugs without medical supervision. Voices from the medical community. Within the medical community, prominent voices are warning of the dangers posed by these unauthorized semaglutide compounds. Doctors have underscored the risks associated with obtaining medications from unverified sources and stress that FDA-approved drugs should always be the first choice. While some physicians acknowledge the existence of reputable compound pharmacies, they caution patients against purchasing from online sources or social media, where regulations are far less stringent. Some practitioners go even further, advising patients to avoid compounded semaglutide altogether. They argue that waiting to obtain the FDA-approved version is far preferable to taking the risk of an unregulated compound that could pose serious health hazards. These medical professionals emphasize that patients should consult their doctors and consider other approved options rather than resort to potentially unsafe alternatives. The risks of online marketplaces. The digital marketplace has added a complex layer to this issue. Online platforms and social media channels have made unauthorized semaglutide compounds readily accessible. Unfortunately, these digital avenues often operate with minimal oversight, making it easy for unscrupulous vendors to market products that may not even contain semaglutide or contain it in unsafe amounts. Reports indicate that consumers increasingly turn to online platforms for semaglutide compounds, attracted by the convenience and often lower prices. However, the risks inherent in these transactions are significant. Unlike FDA-approved drugs obtained from certified pharmacies, these products may lack necessary quality controls, exposing buyers to potential harm. Patients unaware of the origins or potency of these compounds may inadvertently put themselves in life-threatening situations. Patient education and the impact on healthcare providers. This crisis has underscored the importance of patient education regarding the dangers of unauthorized medication. Many healthcare providers have shifted their approach to include extensive patient counseling on the risks associated with compounded drugs. Clinics now devote additional time to educate patients on the value of obtaining medications from legitimate sources, explaining that unauthorized compounds often do not meet FDA standards for safety and efficacy. The situation also highlights a gap in the healthcare system, the need for consistent, transparent communication between healthcare providers, pharmacies, and patients. This educational effort aims to ensure patients fully understand the importance of FDA-approved medications, the risks of unauthorized alternatives, and the steps they can take to make safer healthcare decisions. Charting a path forward, proposed solutions to address this crisis, experts and regulatory authorities are exploring several strategies to enhance patient safety and restore confidence in the medication supply chain. 1. Improved monitoring and reporting. Currently, only certain pharmacies are required to report adverse events involving compounded medications. Expanding these requirements to all compound pharmacies would provide a more accurate picture of the risks associated with unauthorized compounds and allow authorities to respond more effectively. 2. Enhanced oversight of compound pharmacies. Ensuring that compound pharmacies meet federal quality standards is essential to preventing future crises. Strengthening regulations around their operations would reduce the likelihood of unsafe medications entering the market. 3. Expanded provider education. Educating healthcare providers on the proper dosages and administration techniques for compounded medications could reduce dosing errors, protecting patients from accidental overdose or underdose. 4. Improving access to FDA-approved semaglutide. Addressing the shortage of FDA-approved semaglutide could reduce the demand for unauthorized compounds. Ensuring a stable supply would give patients more reliable and safer options. 5. Strengthening online sales regulations. Implementing stricter rules for online marketplaces would make it more difficult for unauthorized compounds to reach vulnerable consumers. Requiring verification for pharmaceutical sales on these platforms could help protect consumers from potentially dangerous products. Practical guidelines for patients seeking semaglutide or similar treatments. Healthcare experts recommend the following: source verification. Only purchase medications from FDA-approved pharmacies or healthcare providers to ensure the product is safe and authentic. Strict dosing protocols. Always follow medical dosing instructions carefully to avoid self-administered dosing errors. Prompt reporting. Report any adverse reactions or side effects immediately to healthcare providers to receive proper guidance. Exercise patience. Although the FDA-approved version of semaglutide may be in limited supply, waiting for it is safer than resorting to an unverified compound. Avoid online sources. Be cautious of purchasing medications through unverified online sources or social media channels. Conclusion: the troubling surge in fatalities and hospitalizations linked to unauthorized semaglutide compounds highlights a serious public health issue. The allure of weight loss or diabetes management through accessible medications has led many to seek out alternatives, often at great personal risk. This crisis serves as a sobering reminder of the FDA's role in safeguarding public health and the importance of adhering to approved treatments and procedures. By working collaboratively, healthcare providers, regulatory authorities, and patients can address this issue and prioritize safety and efficacy in medical treatments. Compounded drugs, when used under the right conditions, provide a valuable service. However, when utilized outside of strict regulatory oversight, they can lead to tragic outcomes. Moving forward, this situation should prompt a comprehensive review of the policies surrounding compounded medications, ensuring they serve their purpose without compromising patient safety. The future of weight loss and diabetes treatment depends on collective responsibility, rigorous oversight, and patient education. With these elements in place, patients can access safer, more effective treatments that improve quality of life without undue risk.